Blake, thanks so much for joining me on the podcast. How are you today?
I'm great, Jared. How are you? Thanks
I'm
for
doing
having
well.
us.
Yeah, I'm doing well. Excited to have you here. Let's dive right in. First off, tell the audience, quick overview of your background, but then give us that really why, how, what of Inbox Health.
Yeah, so I've been doing Inbox Health for 11 years. I founded the company with a friend of mine from grade school, actually. Um, and why is pretty simple. I think anyone in the healthcare space, but I think anyone who lives in the U.S. Has had an experience with patient billing as a consumer and knows it's terrible. It's largely paper-based still. It's really confusing. It's frustrating. It's super expensive. Healthcare is frustrating and unaffordable at the same time. And so that was really the backdrop when we started the company. We really wanted to solve for that consumer experience and build a better patient experience with healthcare billing. But where that ultimately led us was to providers and how they communicate with patients about balances. And building a better software product that let them do a better job of reaching patients with the right messaging, and giving the patients a better experience, so they could ask questions and get answers to those questions about their bills, and then ultimately have better payment experiences. um, and we built a software platform around that pain point, and have built it up over the last 10 years or so now, and are currently working with about 3,500 practices all across the US, and a couple million patients every year using our product right now, and that's continuing to grow rapidly every year. So it's been a really great experience. We've learned a lot, and obviously the healthcare industry is really massive. It's $4 trillion plus dollars, and there's all these little pockets of it. And I think patient billing is one of those pockets, ultimately, but it's one that we all experience pretty regularly as Americans, and usually it's a bad experience, and we really want to change that in a meaningful way.
One of the top reasons, which obviously, patients leave providers because of billing issues. Um,
Mm.
what's the disconnect then there between the providers and the patients when it comes to medical bills?
I think at its heart, providers really aren't that attuned to how the patient's going to experience a bill ultimately, right? They don't really know how much any particular patient is going to end up owing for the care that they're giving. Um, and so it's just not top of mind for the provider, and that experience that the patient ultimately has with their practice on the backside around billing is just not something that they're thinking of typically. And that's started to change a little bit, right? Like it's a lot of money now that's being transacted between patients and providers. And so providers are thinking about it a lot more than they used to, but it's still not, their first thought, right? Like they're focused on the clinical experience in the office, and they should be. Um, but then the patient leaves, and they get a bill and they weren't expecting it. The provider didn't set any expectations around it, and that's going to start to cause friction. And I think at the end of the day, like patients, have two real broad issues with the bills that they end up getting. Like one is that they don't understand why they got a bill, or what it's for. Um, and that's going to obviously cause problems, right? Like a patient doesn't want to pay money and not understand why they're paying that money. And I think the other is that it's inherently unaffordable for many Americans, arguably most Americans. Like they're getting bills for amounts that they can't readily pay, right? Like the average family deductible in the US right now is $4,000 a year. Um, and the average American family does not have $4,000 to pay for their healthcare costs. If something unexpected comes up that's more than, I had the flu and I need to go to the doctor and it's a couple $100. If I have a surgery and it's 3,000, that's going to be an issue. And so there's a lot of these disconnects around all of these workflows and the provider expectations, the patient expectations, and there's misalignment between them. And I think that just leads to those bad experiences.
It's just so crazy that you pay into this all year, and and then you have these high deductibles when you do want to
Yeah.
use the care. Um, even when it comes to many of the preventative care options that, like,
Yeah.
is going to reduce in the long term the cost for the insurance companies. Yeah, it's now let's talk about this. Like, I mean, majority of our billing issue, like of the from the patient perspective, right? Dissatisfaction comes from really current regulations, right? And how the billings, how our health system is set up. So,
Yeah.
when we look at costs are going to continue to rise this year and moving forward. How do you see patient billing really evolving over the next 3 to 5 years? And I guess kind of part two to that question, what changes need to happen for both the patients and providers during that period of time?
Yeah, that's a great question. I think I'll start by saying like the backdrop of all of this is sort of what you alluded to is like the system that we live in is inherently broken, right? Like we've created a system where there's limited competition amongst providers. Providers have monopolies over a lot of the different markets that patients live in, and so you don't have a lot of choice as a patient. Like if you want to go to a hospital and you live where I am, you basically have to go to Yale. Yale controls, I'm in New Haven, Yale controls most of Southern Connecticut's hospital and healthcare systems. Um, and so if I'm a patient and I've had bad experiences with Yale, it's not like I can choose to go to another hospital unless I drive to basically to another state. Um, so that's a problem. And then obviously on the insurance side, all of our insurance is tied to our employer relationship for the most part. If you're on private insurance or you're on Medicare or Medicaid, and the prices keep going up. The price of my premiums are going up, the deductible amount's going up, the price of the healthcare overall is going up. And so all of that's driving to the patient billing friction. We're here living in this market and we're saying, we know this is a broken system. What can we do to make it better? Because we don't see over the next 3 to 5 years a lot of big changes. One of the bigger changes we have seen in the last 2 years is the Consumer Financial Protection Bureau, CFPB, has changed the way medical bills get reported to your credit scores.
I
Um,
saw that.
and made it harder for those to hit your credit scores. But at the same time, we've had an administration change, and the CFPB is a political appointee model with a lot of rulemaking. It's not a lot of like congressional law passing, and so these are just rules, and they're easy to change. So as a new administration comes in with a different view of how medical bills should or shouldn't report to credit bureaus, those rules are likely to change back. And so I guess the answer to your question is like over the next 3 to 5 years, I don't see a lot of big changes happening to the way patients experience billing in the healthcare space, with the only difference being like there's a lot of companies like Inbox Health that are working to create better tools for providers and patients to better communicate with one another, to try to make it better, to try to solve the problems around understanding the bill, clarity of the bill, um, getting answers to questions about your bill, and then ultimately to having a better, more digital experience versus a lot of the paper-based experience we've become sort of accustomed to in the healthcare space. And then the other thing, like we're all, I think, trying to address is affordability, right? Like giving patients more optionality and more tools around how to afford and pay for those healthcare bills, and at the very least, like break them up, right? Like if you have an annual deductible, is there a way for you to pay over time for the majority of care that's too expensive for you to pay in one chunk, and making it really easy to access those options and really cheap to access those options.
Yeah, and are we? I mean, like, do you see a future where patient billing becomes as seamless as like Venmo or Apple Pay? Like, it's still outside of healthcare. It still baffles me when I don't see that. But like,
Yeah.
it's so easy. I mean, when I go to the farmer's market now, I can use Venmo, um, or any store. Mostly, I can use Apple Pay. So, like, do you envision a future where it's going to be as seamless as that at some point?
I mean,
Hopefully sooner.
yeah, no. I mean, absolutely. Like you should have the expectation of your provider that they have a billing experience that's digital and that you have every digital modern payment option available. Like that should be table stakes. And I certainly think within 5 years, every provider should be offering that in some form. I think the problem though is like at the farmer's market, you know what you're buying. And if you want to ask a question about the head of broccoli that you bought, you're talking to the farmer and you can ask them about your broccoli. But if you if you get a bill from your doctor and you want to ask them a question about it, it's like, why am I paying $300? Like, who are you going to ask? And are they going to answer you? And how are you going to ask them? Like, do you have to pick up the phone and call some number and get stuck in a phone tree of people who are unhelpful? Or are you able to text them or use chat to ask them a question? Are you actually going to get an answer that's meaningful to why you owe $200? And in many cases, are you going to get resolutions? Like you need to have clarity around why your billing was done the way it was done and that it was done the right way for you to get comfortable with paying a relatively large amount of money. Um, and so that's like, I think the big thing is like table stakes for sure should be digital experiences in 2025, let alone 2030 for sure. Um, a lot of providers are still using outdated technologies, but I do think they're modernizing pretty rapidly in terms of at least the table stakes payment experience and patient experience with sort of receiving a digital bill, having digital payments. But I think the bigger question is like, did you really believe that you were billed correctly? And did you trust that process? And did you get help and answers to questions when you had them? And I think that's where the system needs to go, is like evolving around how patients engage with those bills and with the support side, to be able to kind of close that loop, because there's so much ambiguity in the patient billing relationship around why I owe what I owe. And basically no one's like sitting there like excited to give you an answer. The insurance company is like, that's not really my problem. Provider did it. And the provider's like, the insurance company did it. You figure it out. Just you have to pay them, otherwise, you can't come back.
I've been trying to make this analogy work recently, but I kind of view it as like, let's say your car gets in a wreck, and the insurance company says, "We'll give you this much money to go and get a new car." So you go to the
Yeah,
dealership and you go to get the new car, but they won't tell you what the new car costs. So you have this much to spend, but it could be, that $30,000 car could be $60,000 car, but you won't know until you go home, and a couple weeks, months later, you get the bill, and then you realize, oh crap, I can't afford this. Um,
yeah,
it's just it's baffling. The Intermountain did a really cool video. I think it was Intermountain, the restaurant where if there was no prices on the
yeah.
menu, or long, it was pretty cool. A while back, yeah. Um,
Yeah,
so
I
yeah,
always
just like
love that restaurant analogy. Like if you went to a restaurant and they could just bring you whatever they wanted, and charge you whatever they wanted, and you were just expected to pay a couple weeks after you left, and they sent you a bill later, and you weren't even at the restaurant anymore. And then when you picked up the phone to call them and to ask, they're like, we're busy right now. Try try again later. But like if you don't pay, we're gonna send you the collection. So
with no explanation. Yeah, it's crazy. It's honestly, it's that's one of the most baffling things if you have to explain it to people in other areas, right, about the US and how our healthcare is. It just, good luck explaining it to them because they don't fully understand it.
Yeah, international like stakeholders, like when we're talking to people from other countries, it's really hard for them to understand the consumer experience here. It's just very, very different from what they'll experience elsewhere. But like that's where we've spent so much of our time and energy on how patients ask questions. Like I think that's always been the overlooked part of it. It's like, hey, let's get really good at sending patients more bills because then they'll pay. It's like, well, maybe. Like one reason why patients might not pay is because they didn't know they had a bill. But it's not one of the top reasons. The top reasons are they don't believe the bill, they don't understand it, they have questions, and you need to answer them. And so we tried to focus on building all these tools and technology around how providers support patients, and make sure that patients have access to real support options. Like, can they ask a question on chat on their billing portal? Can they text a question? And when you do it, you have to get an answer quickly. Like it can't just be like going into like a black hole where like some, support agent that doesn't really know anything gives you an unhelpful answer, or some bot gives you a bad answer. It has to be real meaningful support. And then the other is like affordability. Like you have to be proactive about getting patients payment plan options, and they should be free or close to free. Like that needs to just be table stakes, or you're just not going to get patients to pay.
So when it comes to everything is AI now, all you hear is AI this, AI that, but we hear so much
Yeah.
about AI transforming a variety of areas, but specifically revenue cycle management. Would love to hear more from you about what's the hype, what's real, where does automation actually make an impact in the patient billing?
I mean, there's a ton of great AI work happening on both sides of billing, like on RCM broadly, like on the payer side. I mean, there's been really great work being done for years with machine learning and neural networks. I think there's really cool stuff that can be used from the LLM uh, sort of revolution that's been going on over the last few years to continue to contribute to that. On the patient billing side, I'm really excited about the roles large language models can have in enhancing that support experience. Um, while I think ultimately it's really important to have real people involved in that support experience because LLMs can't do many things still. Um, but I think a combination of large language model enabled AI models applied to patient support experiences with really good training on huge sets of patient support data can really change how patients interact with their bill and get really good answers to their questions about it really quickly all day. Versus like that's really hard to do for any provider group. There's staffing limitations, there's training limitations. It's difficult to answer a lot of these questions, but with the right training data, these models can get really good at giving patients information about their specific bills, their specific insurance. And we're really focused on that particular use case for large language models right now because I think that's the most interesting one, specifically as it relates to patient billing. And I think, like I said, like there has to be a human component. Like at the end of the day, like a lot of the things that patients need is for some action to be taken, and there's ways to automate some of those. But large language models aren't usually going to be the best tool to change how your insurance was billed. Like that has to happen quickly too. But when you need information about your bill and you need to understand it, I think a large language model is a really, really good use case in this particular industry. You need great training data though. And that's why we've been really excited about how we can take millions and millions of patient support interactions we've had about bills over the years with human agents and use that to train large language models to get really good at giving those patients even better information than usually a human agent can give them and give it to them more quickly than a human agent can in many cases. So super excited about that. But across all of RCM, it's really, really cool to see all the stuff that's happening, especially on the front end with scribes. I think that can really transform a lot of how healthcare administration is done prior to getting to the patient billing side. And I think what's cool for us about that is that I think that's where a lot of the breakdown starts is in the office experience where things aren't getting transcribed well. And notes are happening well after the fact from someone who wasn't involved in the clinical encounter. And so basically patients are getting bills that legitimately are wrong because it's basically just people just making stuff up. It's like, hey, this was this visit. I'm coding it this way because this is what we always do. I code it all the same way. But I think having AI, large language model powered scribes in the office, listening to the visits and transcribing them in real time can really create a better accuracy and a better sense of trust around how the visit was sort of recorded and then ultimately billed. And then that patient bill that they get later, I think ends up being more reliable. So I'm excited about both of those things and seeing them come together. I think it'll be really interesting to see how that changes things over the next 5 years, at least in terms of reliability around the patient experience.
Two quick questions for you before we wrap up here. What's one lesson you've learned as a healthcare entrepreneur that you wish you knew when you started?
I think the biggest ones, integrations, are at the heart of everything. I think the reason why healthcare innovation is hard is because data is siloed, usually in an EHR, and EHRs are not well incented to make that data accessible to anyone trying to innovate in it, whether it's a tech company or another EHR, another clinician. The EHRs just are not incented to share that data well. We've tried to change that with the various regulations over the last 20 years with I'll say modest success. But the EHRs have done a really good job of sort of putting guardrails around what they do and don't have to share. And now I think they're getting a little bit better at monetizing the sharing of that data in ways that makes innovation still a little bit difficult. And I'd say if that weren't the case, and if data from an EHR was accessible via an API that was as good as something like a Stripe where like Stripe's a payments company if you're not familiar, but um, like it's very difficult to get data in and out of EHRs, and that makes everything much, much, much harder. And it probably the first 3 years of our company building things out, it was significantly slowed by that limiting factor. And then even today, like, who you can sell to, who you can work with is all guarded by what EHR they use and how accessible the data in that EHR is. And I think it's probably the biggest drag on the healthcare system in the US is like innovation is inherently stopped by EHR data flows being severely constrained. And that's been really hard to change. And I think we'll continue to make innovation difficult unless we can really make a meaningful change to how EHRs behave with that regard.
Last question. What's next for Inbox Health?
I think for us, AI is a huge thing in terms of what's next. But we're doing a lot. When we talked a little bit about that already, but we're doing a lot with pre-visit patient experiences. I'm really excited to try to do more with patients before they have the care and before they leave the office in terms of setting their expectations around costs, and really educating them about what to expect, and really trying to kind of connect the dots between what happens after they leave the visit, and how they experience getting that bill later, and trying to get ahead of that a little bit more and spend more time with them in the office when they're at that point of care, helping them understand, what to expect down the line. Because I think that's where everything starts, right? You got to set expectations well. And we're investing a lot up there at the front desk point of sale interaction. I think there's a lot of cool stuff we could do. We could do from that perspective too. But yeah, we're pretty excited. We're a growing company. We've been at this for 11 years, but I think we're just hitting our stride in a lot of ways, and we're really excited to kind of see where we can take this. 3,500 providers, I think, is a really cool point to be. We're still small and nimble in many ways, but we're starting to have a real impact. It's been really cool to see 2 million patients like use your product. And I think, we're really excited to see how far we can get this in the next 5 years, beyond 2 million and, into something where, your friends and family are regularly using your product, because I think we all experience healthcare. So it's really cool to see people's experience with that healthcare system change as more and more people get to use your products.
Blake, thank you so much for joining me here today. Look forward to continuing to follow along with Inbox Health, and wishing you the best of luck.
Thanks, Jared. This has been awesome. Appreciate the conversation.